If you have spent months on a waiting list only to be handed 6 brief sessions of cognitive behavioral therapy, you have not experienced a clinical failure. You have experienced a mathematical success. The NHS mental health infrastructure, specifically the NHS Talking Therapies program, is not designed as a sanctuary for deep neurological healing. It is engineered as an industrial throughput model. Faced with overwhelming demand and finite funding, the system is mathematically forced to prioritize rapid discharge rates over permanent psychological resolution. Your 6-session limit is not based on neurobiological healing timelines. It is an economic constraint. It is designed to move your data point off the active registry and onto the completed spreadsheet as quickly as possible. To maintain this high-velocity throughput, the system relies almost exclusively on standard Cognitive Behavioural Therapy, or CBT. CBT is a top-down approach. It attempts to use the logical prefrontal cortex to argue with your symptoms. But here is the clinical paradox. When you are trapped in chronic anxiety or depression, your amygdala, the brain's threat detection center, is highly inflamed. It physically hijacks your neural pathways. You cannot logic your way out of a physiological threat response. Attempting to use a worksheet to outthink an activated nervous system is like trying to put out a chemical fire with a spreadsheet. It is biologically inefficient, leaving patients feeling fundamentally broken when the gold standard treatment does not work. You must understand the economic scaffolding of the system you are placing your hope in. The national healthcare model operates on the principle of symptom suppression to restore basic workplace functionality. The goal is not to optimize your dopamine baseline, restructure your cognitive architecture, or heal deep-rooted systemic trauma. The goal is simply to reduce your acute distress just enough so that you can return to the labor force. If the system were to offer the 12 to 24 months of deep somatic and analytical therapy actually required to rewire a damaged nervous system, the entire financial infrastructure of public health would mathematically collapse within a single fiscal quarter. The most glaring flaw in the 6-session conversational model is its complete dismissal of the body. Chronic stress, burnout, and psychological trauma do not just live in your thoughts. They are physically stored in your autonomic nervous system. When you spend 50 minutes talking about your trauma without first regulating your somatic baseline, you are simply triggering the nervous system. You are reinforcing the exact neural loops you are trying to break. You leave the clinical office feeling exhausted, dysregulated, and neurologically worse than when you walked in. This is the neuro-somatic disconnect. The system treats the software, but completely ignores the hardware running it. Outsourcing your mental architecture to a financially constrained, mathematically overburdened government institution is a losing equation. To permanently escape the cycle of anxiety and cognitive friction, you must become your own clinical architect. You must bypass the top-down conversational models and begin with bottom-up somatic regulation. By mastering your dopamine baseline, regulating your vagal tone, and ruthlessly protecting your prefrontal cortex from artificial digital stimulation, you take back control of your biology. Stop waiting for the system to save you. It was never designed to. Initiate the protocol. Reclaim your cortex. But rewriting your biological hardware is mathematically impossible if your vagus nerve remains locked in a chronic state of fight or flight. Click here to see the exact somatic blueprint required to manually override a dysregulated nervous system.